Hi everyone. We've closed off another financial year and this is an opportunity to look back and see how we've performed against our service agreement. The Department of Health sets targets and key performance indicators for us in our service agreement. They're often extremely ambitious and sometimes difficult to meet. They present a challenge, and this year, just past, we have performed very well against a very stretching performance agreement with the Department of Health. Over the past year, we saw 91% of our patients receiving their elective surgery within the recommended time frame. We also met our target of fewer than 50 patients waiting longer than clinically recommended by the end of July. We nearly eliminated outpatient ultra-long waits, coming very close to meeting our target. Despite a 14% growth in the demand for specialist outpatient services, over the past 3 months, the overall waiting list has dropped by 18%. We are also performing extremely well in the emergency department. Last year, 68% of patients were admitted or discharged from our EDs within 4 hours. And while we still have some work to do to meet our targets, it's an extremely pleasing result given the ongoing increases in presentations to our EDs and the complexity and acuity of the presentations to our EDs. These are just a few examples of our terrific performance across our organisation in meeting our service delivery KPIs and targets. Of course, we did that at the same time as we completed the rollout of the digital hospital, the IEMR. That has been a terrific achievement, and we've talked about it several times. To meet those very demanding targets, to serve our community with all of those presentations, elective surgeries, outpatients appointments, to perform as well as we have in that area of KPIs, as well as rolling out our digital hospital successfully. That's been a great achievement. It's been a terrific, terrific year. The board is focusing on our goals, our objectives for the next 5 years. And I'd like to talk to you about one of the key priorities that we're discussing. It's connecting care. Connecting care recognises that as a health service, we already provide excellent health care in our hospitals, our community centres, and all of the places in which we work in our communities. However, we could do better in connecting our services with other healthcare providers in the community. Our electronic medical record, our digital platform, creates an enormous opportunity for us to deliver more connected care for our communities. People receiving the best possible care in the best possible place, and ensuring that only people who really need to be in hospitals are actually in our hospitals. We don't deliver healthcare in isolation in Metro South. We need to form strong connections with our partners. These are other care providers, our GPs, our non-government organisations, the community organisations that abound in our vibrant service area. We need relationships with the community. That ensures right care, right place, right time. This creates a broad health system, and we need to make sure that our community can navigate through that health system, and so they have a safe and effective healthcare journey, always being able to understand and be supported in making the right choices and being in the right place with the right healthcare providers that are appropriate for their needs at the time. Think about how you can provide a more connected experience for your patients, for the community groups that you work with. That's the challenge for each and every one of us in the next 5 years. And we'll need everybody's ideas, and we'll be coming to ask you about them.